I'm Emma Dixon, and today I'm going to talk about my work, Approach Matters, linking practitioners' approaches to technology design for people with dementia. Engagement in meaningful activities is one of the greatest unmet needs for people with dementia. But why is it important to provide active, meaningful engagement to people with dementia? Because studies have shown it increases positive affect and mental well-being. It also delays the progression of cognitive decline. One key player involved in engaging people with dementia in meaningful activities is the practitioner. They work daily with people with dementia, adapting activities and environments to changing cognitive abilities. They learn over time and with experience how to engage people with dementia. Past work urges the HCI community to collaborate with practitioners while conducting technology research with older adults with disabilities. Although this work highlights the potential of this approach in informing our understanding of older adults' needs, we have yet to understand how practitioners' views may affect this collaboration. A second motivation for this work is that research is increasingly attending to the ways that the values of researchers and stakeholders make their way into the design of technology. Past research has examined how societal perceptions shape the ways technology is designed for and received by people with disabilities. Mankoff, Hayes, and Kasnitz draw on disability studies to critically reflect on assistive technologies, arguing the worldviews of technology designers may have negative consequences for users with disabilities. Specifically, technologies created through the lens of the medical model of disability, even if the designers are coming from a helpful place, can lead to exclusion and other negative outcomes. The aim of this research is to present an understanding of practitioners' perspectives concerning the support of meaningful activities using technology, and tensions that arise in practice between the different views that exist in the landscape of dementia care. What was our method? We interviewed 19 practitioners with a range of 3 to 46 years of experience, with an average of 15 years of experience working directly with people with dementia. 17 practiced in the US and 2 in Canada. We had 7 different types of practitioners participate, representing a variety of different disciplines. The interviews were in a semi-structured format and were approximately 1 hour each. Some were in person and some were remote, but all were audio and video recorded. This resulted in 18 hours of transcribed interviews. For analysis, we followed Charmaz's constructivist grounded theory. The first 4 interviews were each open-coded to pull out major themes in the data. Focus coding was then conducted on P5 through P16's interviews, looking for major themes seen in the first 4 interviews, and for discontinuities in the data. Axial coding was then conducted to bridge themes and get a broader sense of the structure of the data. In the last 3 interviews, P17 through P19, the interview questions were modified to highlight major tensions in practitioners' approaches that emerged during previous phases of analysis. Future technology ideas which align with these tensions were pitched to the practitioners for their feedback. Further focus coding was then conducted on these final 3 interviews to clarify ambiguities in the theory presented. So what did we find? We found that practitioners were using 2 opposing perspectives to make sense of the actions of people with dementia, and 2 opposing approaches to engaging people with dementia in activities. I'm going to talk about each of these findings in detail. First, I'm going to explain the 2 perspectives to make sense of the actions of people with dementia. We'll start with practitioners who perceive people with dementia's actions as symptoms of the disease. Practitioners with this mentality often would say things like, sometimes you're going to get that physical pinch and kick and spit, but that's not the normal person, that's just the disease. Within this perspective, practitioners explain seeing any kind of response as a positive response. For example, when P9 perceived someone seemed disengaged from an activity, meaning they were zoned out or even had their eyes closed, she would hit a balloon towards them to wake them up. P12's perspective represents the opposing view, which I will talk about soon, where this tactic was deemed as using a startled response to get people awake. P12 saw this as unkind and disregarding how startling someone might make them feel. We want to draw the link to technology for each perspective we describe in order to show how practitioners' values map to technology design. To do this, I'm going to talk about a basic system and tell you how it might be different according to each perspective. First, we'll consider the case of sensor systems or IoT systems emerging in the literature. These kinds of systems monitor people with dementia to assess states such as level of pain or cognition. Depending on one's understanding of dementia, the same system might be configured for different purposes. With the symptoms of the disease perspective, the actions of someone with dementia are just symptoms. Sensor information might be used to adjust a pharmacological intervention or initiate an activity to distract someone from certain behaviors. Now I'm going to explain the second strategy to make sense of the actions of people with dementia, attributing significance to actions. With the perspective of attributing significance to actions, an action is not a symptom. It's telling you something, that there's an unmet need. P8 says this is like being a detective to find the why of someone's actions. From this perspective, practitioners looked at past formative experiences to explain the actions of their clients. For example, P17 had a client who kept saying, "I'm bored," with the activities at the assisted living facility she was in. P17 found out that this client was a nurse, and she was used to a fast-paced occupation and wasn't being stimulated like she needed or wanted to be in the assisted living facility. P12 explained that the biggest secret, the secret sauce, so to speak, is that no one takes the time to know that person, know their likes, their dislikes, their family history. Were they a mom, a banker? Did they run the PTA? And then building meaningful activities around these things. Now let's return to the IoT system I spoke about, but through the lens of attributing significance to actions. Through this lens, the same sensor system previously explained could be designed to correlate expressions with preceding events, use life history data to find patterns that indicate underlying intent, rather than just adjusting interventions or distracting someone. For example, if someone is always crying out in the afternoon, this can be a pattern the system detects and raises to caregivers as something to look into. And they might find that this crying out is actually because this person is used to having children come home in the afternoon after school, and they are missing that social interaction. To address this need, the system could be set to make phone calls with loved ones in the afternoon when this person typically cries out. The next two strategies I'm going to explain describe how practitioners approach engaging people with dementia in activities, including a pragmatic approach and a respect approach. For these two strategies, we find that practitioners were focused on supporting Maslow's higher order needs, specifically self-actualization, which is to be what it is and who it is that you want to be. In our data, this was described as the need to contribute to society. P7 explains, "I find that folks that are in the facility for long term, they don't want to keep sucking it out of everybody for stuff. They want to get together and give back somehow to the community or each other, and that's really important." Interestingly, how they went about supporting self-actualization activities looked different depending on which of the two approaches practitioners followed. First, I'm going to explain the pragmatic approach. The pragmatic approach included practitioners doing whatever worked to engage with clients. With this approach, the focus of activities is more on enjoyment than on supporting someone and actually contributing to society. With this approach, self-actualization activities are not for a particular outcome or product, but more to support feelings of enjoyment and accomplishment. The focus with the pragmatic approach is on feeling helpful without facilitating actual helpfulness. For example, P1 uses the activity where she has a caregiver set aside a basket of towels to be folded by the person with dementia. But these towels are not actually used by the caregiver. They are strictly to make the client feel as though they are being helpful. With this perspective, practitioners will use any strategy they can to engage with their clients, often drawing on childlike activities because they are failure-free. Activities like coloring with crayons or giving stuffed animals to people that look real, for example, stuffed cats. When considering technologies designed with this approach, We use the example of extended reality systems to aid people with dementia in activities of daily living. For example, a virtual reality cooking activity could be used to stimulate the feeling of cooking, allowing the person with dementia to focus on the enjoyment of the cooking activity without risking failure. In this way, the VR system facilitates the person with dementia to feel as though they are completing an activity independently, even though it's only in the virtual world. I'll now explain the contrasting approach to engaging people with dementia in self-actualizing activities, the respect approach. In this approach, we see practitioners prioritizing dignity and respect. This approach is all about treating people like adults because they are adults. These people have lived full lives. They have served in the military. They have raised children. They have contributed to the community and the workforce in the social betterment of all of us. Practitioners with the respect mentality focus on facilitating volunteering and giving back. As P12 explains, we do art projects for reasons. We make cards for people in the hospital. We take refurbished stuffed animals for children in the hospital. We do activities for purpose. Specifically, practitioners that followed this approach to activities always avoided anything that could be seen as infantilizing, for example, using children's games or crayons. The previously explained virtual reality experience, where the person with dementia would only feel like they were cooking, does not align with the respect approach to activity engagement. From the respect approach, an augmented reality system would be better to aid people with dementia in a cooking activity, because it would facilitate active engagement by the person with dementia through assistance in prompting. For example, the augmented reality system demonstrated in the slide shows augmented cooking directions in a real-world kitchen environment for a cooking activity. I'll conclude this presentation with a brief discussion of this work's contributions. Previous research shows how technology shaped the narrative of people living with dementia and their informal caregivers, urging technology designers to be aware of the models of care their technologies may fall into. Our findings extend this past work by unpacking how different epistemologies affect technology design for people with dementia. Understanding the epistemologies of dementia is important for researchers working with dementia practitioners and people with dementia because the perspectives or even terms that we may assume are benign can carry substantial meaning for those we work with. One contribution of this work is a table outlining 4 different perspectives and strategies described further in our print paper, providing researchers and technology designers with a way to more easily identify which perspectives their own technologies align with. Though we present contrasting approaches practitioners take, and we understand that it is not always easy to do, we advocate an approach that attributes significance to actions and is respect-based, which aligns with dementia and disabilities research in HCI that stresses the need to respect the self-determination of people with dementia, challenging a view of people with disabilities as solely receivers of help. We also argue for researchers and technology designers to be wary of attributing actions of people with dementia simply to symptoms of the disease, or following the pragmatic approach, as these strategies could be infantilizing and diminishing of people with dementia's abilities. Our study opens up new design areas in dementia. Past research has looked into how volunteers can work with people with dementia. We are interested in looking into how people with dementia themselves can volunteer. Technology designers should consider focusing future research on facilitating self-actualization through fulfilling a sense of a vocation, calling, or cause for people with dementia. Future research should investigate how best to design technologies to draw on the abilities of people with dementia to contribute as active members of society. For further areas for future design, please see our print paper. We would like to thank the practitioners who agreed to participate in these research interviews. We would also like to express our gratitude to those who have reviewed versions of this paper. Thank you.